Welcome to Live from HCIC 2023, a podcast series bringing you front row insights from the industry's brightest minds. In this 12-part series, we delve into the heart of the trends impacting health systems with leading experts, senior executives, and thought leaders, as recorded live at the Healthcare Internet Conference in November of 2023. This series is brought to you by Greystone, Bowstring Media, and Touchpoint Media. Listen in as we hear from our industry leaders on the latest innovative strategies and efforts that are shaping our space. I'm here sitting with Paul Matsen from Cleveland Clinic. Paul, thanks for being here on the Live at HCIC show.
Yeah, Chris, great to be with you. I finally get to sit down and do a podcast with you.
Finally. We've been threatening to do it for years, so here we are. But I'm really excited today because you're here at HCIC and you're actually part of a really great panel session I'm looking forward to be part of later on today. And it's really about the changing role of the chief marketing officer in healthcare. But before we jump into that topic, because I think it's going to be a fun topic, I'd love to. I know most people know you, but I would love for you to do a little bit of an introduction for people.
Sure. Happy to do it. I'll keep it brief. I'm just started my 18th year at Cleveland Clinic. Yes, wow. I realized I just crossed over on November 1st to year 18. I was a bit of a unique entity when I joined healthcare in that I came from outside of healthcare. What everybody would say you came from industry. I wasn't familiar with that term, but when I came in, I had previously worked at Delta Airlines. Mm-hmm. And prior to that, I had started my career in New York in the agency business. So 17 years at Cleveland Clinic, I oversee marketing and communications for the enterprise, which we're continuing to grow and evolve our model. So been an incredible experience. I mean, Cleveland Clinic is truly a special place in the healthcare industry because of the culture and the history of the organization, and also because of the tremendous work that goes there, of course, goes on there. Yeah.
Absolutely. And it's interesting. Let's start with that. You talked about how you came from outside of industry to inside industry. We hear that a lot, right? I've been in this space for almost as much time as you have. And it was true, right? As you come in, it's almost like a bit of a culture shock. So how did you feel coming in from outside of industry into this role as the chief marketing officer of the health system?
Yeah, I felt confident that my marketing and communication skills would translate. Mm-hmm. I think they translate broadly across industries. What I didn't realize was how little I knew or understood about healthcare. Mm-hmm. And I can't overstate how little I really knew and understood about healthcare. So it was a steep learning curve. The best gift I received when I joined was our CEO was Toby Cosgrove, the legendary previous CEO of Cleveland Clinic. And he said to me, Paul, the first 90 days, I don't want you to do anything. Take 90 days, talk to all the leaders of the clinical areas, go out and visit all of our facilities, meet all of your team. At the end of 90 days, come back and tell me what you've learned and some ideas on what you want to do going forward. That was a huge gift to begin to understand the complexities of healthcare. I mean, the complexity of our industry and the structure, I think, goes beyond anything else I'd ever worked on before.
Right. But now let's flash forward, right? 18 years. And it feels like every year for me, I learn something new about this industry anyway, right? But the role of the chief marketing officer has evolved significantly since even 18 years ago when you started to learn the industry. I imagine you were probably doing a lot different things then than you are now.
Oh, yeah.
So tell me a little bit about that journey.
So, there are some things I still do. For example, I just wrapped up something I always do this time of year. I met with the leaders of every one of our markets and all of our clinical institutes in small one-on-one meetings. I find that invaluable to build relationships and connections across the enterprise. But when you look at the work, when I joined Cleveland Clinic 2006, we had an internet department of 4 people. I wasn't really sure if I was in charge of the internet or not. IT was involved. We were involved. A lot of the clinical departments had their own people. And we had a project to basically, rebuild the internet into something new, which was woefully behind and over budget. So it was an incredible journey. We had 4 people and 15 million sessions on the website this year. This year, we'll have over 1.1 billion sessions.
Wow.
We have a very advanced content marketing strategy that accompanies digital. I think what makes us a bit unique is how integrated we are. And we leverage all the paid, owned, and earned channels, but our teams work very closely together, and all of our teams leverage digital. So even our corporate communications team does a lot of social media, has a digital newsroom, gets global coverage for their work. So we've evolved the organization over time to really be a digitally first organization on virtually everything we do.
Right. And it's really, I've seen that advance over the years with the Cleveland Clinic. And I think that's really a good example for other health systems, right? As I work with other health systems to bring them digital first, it's great to reflect back on some of the organizations like you that are integrated. But, I think the role of marketing is also evolving and integrating in other ways, not just digital, right? And that's one of the things you're going to be talking about. So let's explore that a little bit with you.
Sure. Yeah.
So it used to be marketing had a very set, this is what we do. We have a silo. We focus on this end. A lot of times it's acquisition, branding, and awareness and things like that. It's not that way anymore. We're integrated across all business strategies now. We work with them. Is that fair?
No, totally true. We are still primarily responsible for the brand, patient acquisition and lead generation. In our organization, all media relations, also all employee, what we call caregiver communications, has become a critically important part of what we do, especially with all the complexity in the world today. But we've built our own data science team. We have our own market research team that serve the organization. We have a very strong marketing account function that works with all of our markets. So we support virtually every area of the business. You've talked about recruitment. That was a huge priority in the last 24 months. But I was talking about the importance of caregivers. We support internal communications to build the caregiver culture. We just did a whole segmentation study on our own caregivers to understand changing preferences and communication styles. We've moved past the baby boomers being the largest cohort in the workforce to millennials and Gen Z, Gen X. They want to consume information very differently. So we're using that to craft our communications. We're also global. So we opened a hospital in London last year. So our team, enterprise team, serves the London market. We partner with our colleagues in Abu Dhabi, Florida, because we are one integrated global brand. So we've done recruitment in the London market, for example.
Wow.
Because they have similar staffing challenges to get the hospital up and running, but are building that brand from the ground up in the UK. So those things are totally fun. I mean, being given a completely white space opportunity like going into a new international market, those are the things you get excited about.
Yeah, and it's still grounded in the kind of the tenets or roots of what marketing communications can do, right? But it's applying these tools in different strategies, different business goals that you're trying to accomplish. And I think that's what's interesting about this, right? We live in a world now where we have the rooted tenets of what we need to do, but we also have all these ways in which we can understand our audiences, segment them. Tell us a little bit like that in and of itself, I think has reinforced and elevated what marketing's role is.
I'll stick with London for a second. We had a conversation with the London team recently. We've been tracking our brand awareness specifically for Cleveland Clinic, the brand, and Cleveland Clinic London, the facility, since before we opened. So, critically important. It's good discipline before you put something new in the market. Do you have a baseline? And we've been able to track our improvement. The interesting thing is the content marketing and digital strategies we use in the U.S. are working very well in the U.K. Now, there are limitations because of GDPR on certain things we can do from a patient acquisition perspective. But for example, our content marketing strategies are very successful in the UK. And the UK is one of our top global markets for traffic for our health information. So, those certain things are global. I've traveled around the world to places like in the Middle East where people are consuming our health content. And that's incredibly gratifying when you're trying to build a brand, because that's where health content or content in general can be a tremendous differentiator. If it's out there, if it's successful, it's like we describe it as an annuity. You run an ad, you run it, it's gone. Build health content, it stays out, it's discoverable,
right,
and you can keep reaching new audiences. So we've invested quite intentionally in building health content in recent years.
And your health content, I mean, that's one of the things is, I think it was like maybe 10, 15 years ago, we were starting to think about this concept of content strategy, right? And knowing the implications that it has for the brand, for the reputation of your organization, for really, in effect, establishing credibility and authority of what we do as an industry. I think it's incredibly important for us. And we all started to embrace content strategy again, looking to you for examples of how to do that well. And, I think that content strategy has evolved over the years too, right?
Yeah.
Through the pandemic, there's all this misinformation and this is a big thing that right now with social media is a big challenge. Having content presence to help combat misinformation on social platforms is significant. And you're doing some work there.
Well, I would say Google is keenly focused on wanting to present the most trusted health content to patients and consumers. And so they continue to adapt their algorithm and it preferences content towards organizations like Cleveland Clinic, National Institutes of Health, Mayo Clinic, because we have medically vetted content and we're trusted medical brands. So that's what they want their consumers to find. We had a partnership with YouTube where YouTube was partnering with us to create specific videos. They work with several other health systems as well. And it was a great partnership. They were paying for some of the content creation to fill gaps that they identified through search. And then recently we partnered with TikTok because we continue to experiment on platform. I won't even call it experiment anymore. We can continue to be present on TikTok. It reaches a new generation of social media users, as does Instagram and Instagram Reels. We can use a lot of video storytelling, but they specifically wanted to focus on mental health. And they saw our mental health content as being valuable to their users. So they selected us as one of their 2 partners, and we hope to do more. So that's where content can create new sets of opportunities that, if you had asked me 5 years ago, would we have been on TikTok? Would we be creating content and these kinds of partnership models? I couldn't have foreseen that, honestly.
Right. But it's really reinforcing. Again, I see there's a theme here, concurrent theme here of it's rooted into what Cleveland Clinic is trying to represent from a authoritative source of healthcare information to support the entire world and being able to use that to amplify it through whatever channel it might be. And we were just talking before we started recording about now you're kind of experimenting in the new technology that everyone's talking about. You want to share a little bit about that?
Sure. You're joking around with Chris that last year, probably around December, OpenAI revealed ChatGPT to the world, and it was, became quite an event. Everybody was talking about ChatGPT and generative AI. Every earnings announcement, it was, how often could someone mention ChatGPT in their presentation? And we got a lot of inquiry from our leadership. What was marketing going to do? There's a lot of work that's going on across the clinical enterprise as well. And we've been involved in the development of policies and how AI should be used and used appropriately. But beyond that, we wanted to go through a structured process for marketing, not just pick one-off solutions, but we hired a partner. We brought our whole marketing communications division in and gave everybody an overview of AI. And that was to really demystify it, to try to take any fears out of the process. Then we broke up over time into teams to develop what could the use cases be. And we've zeroed in on 5 use cases now, and we've selected technologies for those use cases, and we're beginning to implement the early phases of the pilot. And then the goal will be to measure, how does it impact our content creation? Does it make us more effective? And can we become more efficient over time as well?
Right.
And, we're working on writing efficiency, competitive analysis, content performance and data analysis, social media efficiencies, creating content, headlines, so forth. And then podcasting efficiency, including editing podcasts. You may use AI to edit your podcasts. I don't know, but these tools are here.
Yeah, they are.
They're incredibly powerful.
Yeah, and in particular, in my case, I use AI to transcribe podcasts.
Exactly.
And that's like a great value add, right? Whereas before you would invest that in people time.
Right.
Now you can very quickly just transcribe.
I mean, it's really not a great use of a human being's time and effort to do transcription and of course now we have Microsoft 365. Yeah, you can have it transcribe your Teams meeting in real time. So those are things people have to get comfortable with. Yeah. But they can be very valuable tools, especially, from a workforce perspective, keeping people connected in a virtual environment, having tools like transcription, which you can record the meetings, but it's another great tool if people want that material. So so we're excited. We think we're on the right track. Yeah. And we're planning a 6-month pilot, and then we'll evaluate, and then possibly then make it a full-time, long-term investment.
What you're describing is like sort of a framework about how you approach any kind of new approach or the strategy that you're trying to introduce in marketing communication, but it's still rooted in understanding what the objective is, understanding what the new tool or technology is, or the new whatever that strategy may be, developing success measurements, measuring against it, piloting it, testing it, iterating, etc. And I think that kind of discipline is really important. And now I'm going to take a little bit of a turn because we also were talking about how healthcare marketing right now and CMOs across the country are faced with some unprecedented challenges right now. And I believe a little bit of that discipline that you're describing, that framework around how do we approach it, can help you be a little bit more resilient through even the low times. Want to share a little bit about your thoughts?
I think you said the key word there, which is resiliency. I mean, if you work long enough, you're going to have up times when the organization is thriving, there's investable dollars, and you're going to have downtimes. I worked through a Chapter 11 bankruptcy after 9/11 when I worked in the airline industry. So, those are some tough, dark days. But as a leader, you've got to help your team be resilient and work through it. And you've got to have the discipline not to get overly emotional about it, but to really take a smart approach to how you're going to manage resources. And that's how we think about it. And so we spent a lot of time as a leadership team in marketing and communications at the clinic prioritizing our work. And we plan all together in my leadership team. It's an integrated process. We select our objectives and key measurements together every year. We do a set of enterprise priority projects every year that we expect everybody will contribute to. And then we prioritize the dollars. And it's, those can be tough conversations. We had to take dollars out this year. I think most people for 2024, most people are having to do the same thing. And then the last thing, I would go back to what we were talking about earlier. You have to maintain your communications. You can't go into a shell or protective crouch. You still have to engage with executive leadership. You still have to engage with clinical leadership, shared services, and be transparent. Let them know what your dollars are being invested in. Let them know what things are not going to be invested in, so that everybody understands where the tough calls are being made. And I think that enables resiliency. That level of discipline and that level of transparency will help teams get through these kinds of situations.
Right. And it comes back to our original, the topic that we're talking about is that this role as the chief marketing communications officer has a lot of responsibility and a lot of influence. And with great power comes great responsibility, right? As Peter Parker's aunt would say, right? Yeah. Is that you need to be able to share what you're doing and be transparent, and that really shows how the role of the CMO has changed. So it's almost like every year you reinvent yourself as a chief marketing officer, but you're kind of building on what you've learned. And so I think back to your when you started 18 years ago. It's constantly learning and growing.
Totally.
Right?
You have to constantly embrace new technology. You have to understand and manage through the change that's happening in the industry. And you have to encourage your organization to adapt. For many years, when I first joined the healthcare industry, I was taken aback by how paper intensive it was and how much we produced, and they were beautiful, glossy publications, and they cost a tremendous amount of money, but they didn't reach a huge number of people, and we certainly had no data on how many people were reading it. And we evolved to a mantra of we need to think first digital, then mobile, and then measurable. We knew we weren't going to eliminate, we weren't striving to eliminate paper entirely. And at first, there was a lot of resistance from our clinical partners, but our CEO got on board. And, we moved to a completely digital annual report, for example. So all of a sudden, you're setting a pathway to show everybody there's a different way to do these things. And, I would say, I remember when we started social media and where it now can look back at where it is now, content strategy and where it is now. And I look at AI and all I see is opportunity.
Yeah.
I don't see a threat. I mean, I know it could displace some traditional roles, but it also could change and enhance the way we deliver our work. And I think that's the spirit in which anybody who's in a leadership position should embrace it.
Man, well, that's such great words, Paul. Thank you so much for your time.
Great to get
great conversation.
Finally get to the podcast.
We covered a lot today, so no, I really appreciate that.
Yeah.
Thanks so much for coming on and sharing your expertise.
Thanks, Chris.
Yes.
It was a pleasure. Yeah.
Thank you for watching live from HCIC 2023. We hope these insights have sparked new ideas and conversations. A special thanks to the industry experts featured on our show, and to Greystone, Bowstring Media, and Touchpoint Media for making these discussions available. For more episodes and exclusive content, please visit Greystone.Net, Touchpoint.health, or subscribe through your favorite podcast listening platform. If you want to be part of more conversations like this one, please make sure to attend the Healthcare Internet Conference in Austin, Texas. You can find more details at hcic.net.